Okay, yesterday we started our discussion about drugs, anti-hyperlipidemic agents. So we had our introduction about the different types of lipids in the body. We have the phospholipids. They are found all over the body, but then we have more of it on our nervous system. And then our cholesterol also, that is very important in the formation of our cell membrane for stability. And then lastly, we have the triglycerides, which are the oils and fats. Component nun are the glycerol and the fatty acids. Now, if you have increased level of these lipids, we will have conditions like acute pancreatitis, or the most common one, the atherosclerosis, which is the formation of a plaque in the arteries that will obstruct blood flow. And that it will lead to more cardiovascular conditions like heart failure, angina, or coronary artery diseases pa na nauban. However, natay mga lipid disorders class. Here, I think we started our discussion with the lipid lipoprotein disorders. Remember, how do we test this? We test this using the blood. We measure the amount of lipids in the blood. After 10 hours of fasting, our ideal value is less than 120 milligrams per deciliter, but for those who are at risk of having coronary or cardiovascular diseases, the requirement is 60 milligrams per deciliter. So last time, yesterday, we started with the discussion of the type 1 lipoprotein disorder, which is also known as familial hyperchylomicronemia, which involves defect in the genes of a person, leading to the deficiency of the enzyme called lipoprotein lipase, or its cofactor. Now, since there is a decrease in the lipoprotein lipase, that will result to the increase in the triglyceride levels in the blood, the fats, and the oil. Now, this type of lipoprotein disorder does not really have specific signs and symptoms that will contribute to the early diagnosis of the condition, but most of the time, the patient will be diagnosed if there is already an attack for acute pancreatitis. Now, if we check the patient, other signs and symptoms will be eruptive xanthoma, or there will be enlargement of the liver and the spleen, or hyperactivity of the spleen. We call that hypersplenism. And there will be lipids na surrounding the organs like the bone marrow, the liver, and the spleen. Now, this type class of lipoprotein disorder does not really have drug therapy so far. So our treatment for the patient is diet only. So low fat diet. Now, the type 2A is called familial hypercholesterolemia, which is again a genetic defect. Now, this time, the problem is on the LDL receptor. So remember that the LDL is one type of cholesterol, and that if it is increased in the blood, syempre, we call it hypercholesterolemia. So the increase in LDL can be visible even in throughout childhood, because again, this is a genetic defect. So kahit bata pa pwede nang makita, even baby pa siya, i-evaluate or i-assess, i-test ang umbilical cord for blood cholesterol, and we will really see there that there is an elevation for the cholesterol level. So what is the difference between type 1 and type 2A? Type 1 is there is an increase in triglyceride, while type 2 there is actually a normal level for triglyceride pero there is an increased serum cholesterol level. Now for the type 2, we have drugs like niacin, ezetimibe, and our statins, which is also called reductase inhibitors, that can be used for this type of condition. Though diet is still number one for this. We will be discussing the different types of drugs later. Let's just finish the lipoprotein disorders. Now, after the type 2A, we have the type 2B. This time, it is called familial combined or mixed hyperlipidemia. So, why is it called combined or mixed hyperlipidemia? Because aside from the increase in the cholesterol level in the blood, there will also be an increase in the triglyceride level. So, combined siya, or a combination of the type 1 and the type 2. So again, similar to type 2A, except that the VLDL is also increased. That will lead to the increase also of the triglycerides. So what is the problem for a person with type 2B disorder? There is class an overproduction of the VLDL in the liver. So very low density lipoprotein, remember, is produced in the liver, and that for type 2B nag-overproduce ang liver. So VLDL is a cholesterol, but when you break down the VLDL, it will actually be converted into triglyceride. So mix na siya, both cholesterol and triglyceride. Now how about the treatment? The treatment is still number one, diet, but since this is similar to type 2A, then the drugs used here is similar also. We have the niacin, ezetimibe, and our statins or the reductase inhibitor. Okay? Now the type 3. The type 3 is called Familial Dysbetalipoproteinemia. Again, it is called Familial Dysbetalipoproteinemia. Now, what is the problem for this type? There is an increase in the IDL level in the blood. By the way, IDL means intermediate density lipoprotein. Now, this type of lipoprotein or cholesterol, just like the VLDL, will result to the increase of triglycerides in the blood. So, dili lang triglyceride, apil ang cholesterol. So, parehas sila. Actually, parehas sila sa type 2B na pag i-check na to ang blood sa patient, taas ang cholesterol, taas ang triglyceride, pero lahi manggod ang ilang hinungdan. Sa type 2A, the reason is there is overproduction of the VLDL. While sa type 3, there is an increase or overproduction or underutilization of the IDL or the intermediate density lipoprotein because of a mutation gihapon, a problem with the gene expressing the apolipoprotein E. So this type of protein actually uses the IDL. So pag nag-underutilize na siya mo na nga mudaghan kaayo ang IDL, that will lead to the increase in the TG and the cholesterol. Now, what are the signs and symptoms of familial dysbetalipoproteinemia? We have here tuberous or tubo-eruptive xanthomas or characteristic planar xanthomas. Later, I will show you a picture of that na makikita yan siya class sa palmar creases sa mga kamot. And then there will be obesity, and some of the patients with this type of condition has glucose tolerance. That will lead to, syempre, diabetes. Now, what will be the treatment for this? Syempre, diet. There will be lifestyle change, and there is still the niacin, the fibrate, and the statins or the reductase inhibitor. So this is class, this is the picture of the planar xanthomas. Kaning naa sa taas, mao na siya ang planar xanthomas. This one is an indication that you have an increased triglyceride and cholesterol in the body. Murag mag-yellow kani bitaw mga linya sa ato ang kamot. Mura na siya mag-yellow na magsinaw, na murag ka ng oily bitaw. So, mo na siya ang ginatawag og planar xanthomas. And then kanang picture sa baba, that's what we call tuberous or tubo-eruptive xanthomas. So, murag mga ano lang na murag mga inflamed, gagmay na mga inflammation. But then again, nahimo na siya og signs and symptoms that you have increased cholesterol and triglycerides in the body. Okay, questions so far about this type of condition? Wala. Mag-unmute ha. Now we have here the type 4, also known as the familial hypertriglyceridemia. So what is the problem here? There is increased VLDL. Again, the one that is increased here is the VLDL, though the LDL can be normal or decreased. So again, ang taas kay VLDL, that will lead to the formation of the triglycerides. But if we look at the LDL level, sometimes for some patients it's normal, but for some patients it's decreased. So in the result of the lipid profiling, either you can see normal or elevated cholesterol, pero ang grabe yun na makita nato din ha is the circulating triglyceride is very elevated. Now, what is the cause for this? There is an overproduction or decreased excretion or removal in the body of our VLDL and triglycerides. Now, for the treatment of the hypertriglyceridemia, we don't have the statins here because statins is more on the cholesterol. So, we can have here the niacin and the fenofibrate. Siyempre, the diet is common. Now, you can actually see or observe hypertriglyceridemia to those patients na naay centripetal obesity. Again, we call it centripetal obesity. Anong gitawag siya centripetal obesity? Kanina, kung nga part sa body, the stomach class will really be big, like in the picture you can see, di ba? We call that centripetal obesity. Kanang mudako gani kayo ang tiyan, tambok pag maayo niya dako kayo ang tiyan class, centripetal obesity ang tawag ana. And again, that is an indication na there is an increase in the triglyceride. So if we check their lipid profile, their cholesterol may be normal, but the triglyceride level will be elevated. Remember, the triglycerides refer to the fats and the oils. Oo, apil ang breast magdako aside from the stomach. Remember, our breast is mostly made up of fats. So, pag magtambok ka class, actually, mudako pud na imuhang breast. Not just for men, it's also true for women. And pag mamayak ka, you will really notice na mugamay pud ang imuhang breast. Oh, kasi that's fats. So actually, if you go to the gym, for women, we are not encouraged to do weights like mag-dumbbell or something, because that will actually lead to magamay ang imuhang breast size class. So wala ta naga-weights. Ay dili siya kanang advisable for women to do weights unless na lang gusto gyud ka mo gamay imuhang breast size. You do weights. So look at the athletes, even Heidelin Diaz, since syempre weightlifter siya, dako kay siya glawas, pero gamay siya breast, di ba? The volleyball players are also one nagamay og breast size kay they do a lot of exercise in their upper body. Donate. Sambok ka. Ipanghatag na lang ni Jess sa iyahang breast. Dili na ka na Jess, ng load na ka. Papayat. Yeah, papayat is the key. Diba I told you yesterday, I go down from 68 kilos to 53 kilos last time. And ang pinakauna jud na ko napansin mo kay luag akong tanang bra. Luag tanan akong bra class mo na siya ang reason nga before sa sinina nakapalit yung kong bagong bra kay luag tanan, and then the rest gipang adjust na lang nako. So mao gyud na siya ang unang makita nimo pag nagpapayat ka luag imong bra. Ayun nagbra. Ang mga Amerikano wala na sila nagabra no. Actually, according to studies, there is no correlation between wearing bra and breast cancer. But if you do exercise, you really need to wear your bra para dili gud magsigig lihok ang imuhang breast. Pero ang advice na lang sa mga doctors is you can wear bra. The maximum is 12 hours. So after 12 hours, you really need to ihubuan na ninyo inyong bra after 12 hours. Ayaw mo patulog og naga-bra class. Sa mukha ni Sarah. Actually, I have not yet read about that. Ang ako lang yung mabalaan ka ng mga hearsay bitaw na sa mga lalaki, pag magsige na sila og gym, magpadako sila glawas, mugamay ang ilahang organ. Mabatian ko lang na siya perme, pero wala man gud nako siya gituyo og search bitaw. Natuyon jud ako siya search para mabalaan ako no wala man gud nako nagibuhat. So far wala ko kabalo if tinuod ba na siya na mugamay ang ilaha. Yeah, there are people class na tambok bitaw abi ni mugdakog tutoy pero actually they don't have big breast. It's just that nidako lang na siya kay tungod ni tambok sila, pero pag makita nimo na sila mo payat, gamay dai sila breast size. Lahi gyud nang kanang payat haw niya dako jud sila breast kato dako gyud. Unsaon ni luag sa mukha oy. Pag ilis na og bra Claire nganong luag man na. Go. Magnasaon sa ka Julia Barreto mag nipple tape. Anyway, let's continue. Again, we call this centripetal obesity ha kanang mudako gani pag maayo ang tiyan nga mas dako pa siya sa imuhang breast size. So ang kanang uban man gud dili man gud sila kana bitaw kanang nagapa-check gyud og lipid profile, pero kung i-check nato na class dako jud kay ang possibility na they have increased triglycerides in their blood. So ang palit man kag bra nga wala man kay brahan, nagsayang-sayang lang sa imong bra. So next we'll have type 5 or also known as familial mixed hypertriglyceridemia. There is increased VLDL here and also chylomicrons, but the LDL can be normal, pwede pod decreased. So aside from that, actually i-add na to no kasi the result can be either normal or elevated cholesterol. But then again, since this is hypertriglyceridemia, the problem is still the triglycerides. So, what is the cause nga nung magtaas ang triglyceride? There will be increased production or decreased excretion of the VLDL and the chylomicrons. So, mo na siya nga mixed ha kay duha, VLDL and the chylomicrons. And this is usually because of a genetic defect. So, siya, ang ato ang mga pagtaas sa mga lipid levels, it's all about the genes. Therefore, it can be passed on from one generation to another generation. So, if your parents have this kind of condition, most likely you may also you may also have those kind of condition. But you can choose kung kano saan na siya mugawa. So, you have to be careful with your lifestyle. Now, the the people with the type 5 lipoprotein disorder, mostly adults, and ano sila, obese and diabetic. Now, what are the treatments used for the type 5 familial mixed hypertriglyceridemia? Siyempre, ang diet dili yun na siya mawala. The niacin, fenofibrate, and since there can be an increase in cholesterol, so balik na to si reductase inhibitor dinhi or ang atuang mga statins. Now, HDL deficiency. For the HDL deficiency, remember that high-density lipoprotein is our good cholesterol because it does housekeeping, retrieval of the excess cholesterol in our arteries, take it back to the liver, and then pwede na to siya ma-excrete. But if you have problem with the HDL, mugamay ang iyahang level in the body, magkaroon tag problem, mag-lead gihapon siya into the formation of atherosclerotic plaque. Kaya wala na may manglimpyo sa arteries. So there are also genetic disorders, again, genetic disorders gihapon ha, that will lead to the deficiency of the HDL in the body. So we have here the Tanger disease. If we look at sa Google ha niya, magbasa tag Tanger disease, ang nakabutang yun din ha, because of a problem of a certain gene, sa Tanger disease, mubaba pag maayo ang high density lipoprotein. So the liver will not be able to produce more of this. That's the same thing with the LCAT deficiency. LCAT means lecithin cholesterol acyltransferase. It is actually an enzyme that will, what you call that, activate or stimulate the HDL sa iyahang pagpanglimpyo sa blood. So kung kulang ka ana nga enzyme, that's the same thing. Dili pud magtrabaho og tarong ang imuhang HDL, walay manglimpyo, then that will lead to atherosclerosis. Now we only have one drug that can increase the HDL here, and that is the niacin. Okay, we call it niacin. If we look at the lipid profile of the patient and ang nakabutang dito, there is decrease in the HDL, then again, we can give the niacin. Okay? Now, what are the secondary causes of hyperlipoproteinemia? Mga secondary causes ito ha, kasi the primary cause, kung naminaw mo from the type 1, genetic defect. May mga genetic defect sila. So, mo na nga nag-increase either ilang cholesterol, ilang triglyceride, or both. But we have secondary causes that will lead to the increase of cholesterol and triglycerides in the body. Now, for hypertriglyceridemia, the secondary causes that can increase both oils and fats in the body, we have diabetes mellitus. So, ano gid na siya kanang partner gid ni sila. The alcohol ingestion, so na-mention na ko na last time, that the alcohol ingestion can also lead to deposition of fats and oils in our adipose tissues, severe nephrosis if the patient has problem with the kidneys, estrogens and uremia. So, mo bito ng bitong class ng naga-pills. Have you heard of that? Kanang mag-pills ba niya? Ang pills is estrogen or estrogen derivative. Di ba ang isa ka side effect ana sa mga girls nga naga-pills kay mutambok sila. So mo na siya karon kasi estrogen can lead to deposition of fats also. And then uremia, corticosteroid excess, mo na siya pod ang hinungdan sa kanang mga asthmatic patients na masubraan bitaw sa ilahang corticosteroid. Kung sa'yo mahitabo sa ilaha, manghupong sila or mutambok sila, mag-cause siya og hypertriglyceridemia. The mixed edema also, the mixed edema actually is the severe hypothyroidism. Severe na siya, severe na hypothyroidism. And then glycogen storage disease, if we have problems with our pathways like sa glycogenesis or sa glycogenolysis, hypopituitarism or the decrease in the work or function of our pituitary gland. And lastly, we have the drug called isotretinoin. That's the name of the drug, ha, isotretinoin. So si isotretinoin is used for acne, mga girls. Pero this one is just used topically. Pero kung ingested man good, we can have problem with the triglycerides here. By the way, isotretinoin should not be used if you are pregnant. Yan na kay acne nun, igagamitan mo siya isotretinoin because this one is a teratogenic agent. Okay, so these are the secondary causes of hypertriglyceridemia. Now, how about the hypercholesterolemia? Magtaas ang cholesterol in the body. It may be because also of the hypothyroidism, early nephrosis, early bago pa nagsugod ang problem with the kidneys, resolving lipemia. By the way, lipemia is taas nga triglyceride. Pag mag-subside manggod na, pag mawala ang triglyceride, pag taas niya, usahay manggod mag-shift siya, mag-beta shift siya. So, ang iyahang i-produce daghan na cholesterol. So, pag maayo na ang hypertriglyceridemia, mag-shift na siya into hypercholesterolemia. And then, we have here immunoglobulin lipoprotein complex disorders, cholestasis or the formation of gallstones, or the problem with the bile, I mean. So, example na obstruction sa bile, dili ni mo ma-excrete, mudaghan po di mo hang cholesterol anak class. Sabi na pag wala na kay bile. Kasi remember, ang trabaho sa bile is to excrete cholesterol also. And then hypopituitarism and corticosteroid excess. So parehas sila with the hypertriglyceridemia. Let me check first. Yeah. Okay. Questions so far? Or shall we continue? We have here dietary management of hyperlipoproteinemia. Kaya ang ato ang number 1 nga drug for this kay diet. So let's talk about food and the thing that we need to do para dili ta magkaroon aning disorder. So take note, cholesterol and saturated and trans fats are principal factors na mag-increase ang atuang LDL. So kung mahilig ka magkaon og cholesterol-rich foods and mga saturated and trans fats-rich foods, kana number 1 yun na siya na makapa-increase og LDL kay daghan man ka og source. And then ang total fat, you can actually see that sa mga foods na ato ang ginapalit, no, kay nabi yan na nutrition sa example sa likod sa label. Look at the total fat there. Alcohol kanang mga palatungga kayo dira, and excess calories will increase triglycerides. So when you say excess calories, most of the time if we look at the labels ato ang mga food nga ginakaon ang nakabutang 2,000 calories per day. So if you have excess of that will lead to increase in the triglycerides. Pero lami ang fries. The fries is one of the killer foods na do, diba? Because number 1, it's potato. So yeah, it's rich in carbohydrates. Now it's being deep fried. So yes, the oil is there. And you are adding salt also. So nga. Grabe ang calories for that. So it may increase the triglyceride levels nato sa lawas. So take note of this. Sucrose ha, table sugar, and even fructose can actually increase our VLDL in the body. Remember, VLDL, once na ma-oxidize or ma-process siya sa atong body, it will still lead to fats and oils. So, triglyceride gihapon to. Manang ginaingon class nga, we should not be into sweets kaayo kasi atong mga sweets no, most likely sucrose ang ginagamit nato as sweetener. And ang sa fruit pod, though it is really advisable to eat fruits, pero dili pod pwede nga sobra. Kumukaon kag saging, isa lang, dili isa ka sipik. Nakuha kay that is rich in fructose also, you may be at risk of diabetes also for that because fructose in the body will be transformed into glucose gihapon. And aside from that, it can increase also the VLDL. I hope that is clear. So again, kung mukaon kag saging, isa lang, ayaw isa ka sipik. Or kung mukaon ka, og example, rambutan, ganang pila rapod ka buok, di po nang isa ka kilo, ikaw lay mo, hurot. Okay? I hope clear na siya. It is really advisable to eat fruits, pero everything should be in moderation. And lastly, we have here the alcohol. Kani kalaban jud kaayo ni kung si nicotine class, si smoking is kalaban kaayo sa heart. Si alcohol, actually padulong gihapon siya sa heart, pero most likely alcohol will really increase the triglycerides in the body. So that is the reason why diba, we have the so-called beer belly. Kay mag-deposit yun class ang fats sa adipose tissues if we are into alcoholism. Okay? Mag-increase ang mag-increase ang triglycerides by increasing hepatic secretion of the VLDL. Questions so far? Fructose. Magsigi sila unsa? Di ba ma'am, ang semen sa lalaki may ara fructose, so kung magsigi sila, ma'am, mutaas po daw. Kasi magsigi sila, magsigi og. Sige, kaon ng fruits. Madali, nalibog ko sa magsigi sila gunsa. Isa mo pa ni mo. Not really. That is exercise for them actually. Diba? They are burning calories when they do that. Again, if they do that thing, that is actually a physical activity. They are burning calories for that. Wala problema. Hangtod sa kaya nila go. Magsige ka ng fruits. Magsige ka ng fruits. Fruits are really beneficial in our body. It's just that it has to be in moderation. Because remember, fruits also contain sugar. And that it will add up to the sugar in the body and also the fats. Nakalimot ko. Nakalimot ko, isipin na ako siya niya. Saan na ako? Sa safe? Say safe. Sa mukha. Sa mukha. Anyway, let us continue. Use of complex carbohydrates and fiber is recommended, and cis monounsaturated fats should predominate. So, mauna siya class nga, for example, between white rice and black rice, more on complex carbohydrates kasi ang black rice compared sa white. So, mauna siya nga, mauna ang advisable na rice para dili kaayo siya daghan og kanang carbs yun. I mean, complex dapat ang iyang carbs. So actually lisod na siya metabolize no, and then dili pud siya kay mag-breakdown, so dili siya magdaghan ng glucose sa imong body. Or kung magkaon ka og fatty foods or oily foods, it has to be cis monounsaturated fats. The fiber also, so you have to look for foods na rich in fiber kasi ang fiber manggod can really bulky mo ng fiber no, pero dili man good siya kanang ma-absorb good na, I mean wala siya kayo sugar bitaw. Pero mabusog ka. Gusto gay ka maka-poops, di ba, magkaon ka og fiber. So weight reduction, caloric restriction, and avoidance of alcohol are especially important for this kind of condition. Diet, good, diet. Caloric restriction. So, di ba, the recommended is 2,000 calories per day. Actually, I have tried caloric counting. So, nag-limit ko 1,200 per day. So, ano ko, 400 kada pamahaw paniudto, panihapon. Nakatry ko mag-caloric counting. Ano naman ni si Sarah? Sa mukha. Okay, now let's talk about the omega-3 fatty acids, or that's what we see sa fish oils. So, mga ano na to ni sila, mga unsaturated na mga fats or mga oils. So, mo ni siya class ang good for us. Actually, the omega-3 fatty acids can reduce the triglycerides that we have. And then napo na siya anti-inflammatory nga activity and anti-arrhythmic activity. So you can see people class na nag-take sila aning fish oil or ang nakabutang sa label kay omega-3 fatty acids. But ang omega-6 fatty acids though ano gihapon siya no kanang unsaturated fatty acid gihapon siya, pero it may actually increase the triglycerides. So, mo niya itong makita sa mga vegetable oils like palm oils, coconut oils. They are actually rich sa omega-6 fatty acids. And remember, maka-increase siya og triglyceride. Mao na nga magbawas-bawas ta og sigig prito. Kaya kanang ginagamit ra ba nato magprito mga vegetable oils ra ba na, diba? Mostly palm oil. Others will use coconut oil, but then again, nagihapon siya omega-6 fatty acid. Okay, and then we have here the homocysteine that is actually pro-arthrogenic, meaning it can lead also to the formation of atherosclerotic plaque. Now, if the person has severe homocysteinemia, again, mag-lead siya into the formation of atherosclerotic plaque. So we have to limit the intake of the person sa total protein also. Okay? Kaya ang cysteine, remember, is an amino acid. So, pero pag kanang amino acid, daghan kayo sa imong lawas, mahimo siya pro-arthrogenic. So, napoy part gamay ang protein ani, ilimit nato. Now, the treatment for severe homocysteinemia is the folic acid plus the vitamin B. Okay? Again, folic acid plus vitamin B. Now, let's move on to our drugs. Kung dili na gyud kaya sa diet class, kailangan na gyud og intervention, clinical intervention, then we have the following drugs. The first one, we have the competitive inhibitor of the HMG-CoA reductase. Please review our cholesterol pathway. We call them reductase inhibitors, but they are commonly known in the medical world as the statins because their names end with statin. So what are the examples of the statins? We have the lovastatin. Ang nasa open and close parentheses are the common na mga brand names nila. Atorvastatin is the Lipitor. Fluvastatin, pravastatin, the most common ones, simvastatin and atorvastatin. And then the newer one is the rosuvastatin. So actually, the doctors are shifting to rosuvastatin nowadays because among the statins, it is the less toxic and less ang iyahang side effects. So we have here the Crestor, but this is not these drugs are not cheap. Simvastatin may have a generic counterpart na cheaper, pero the atorvastatin, especially Lipitor and the rosuvastatin, are expensive drugs. Now again, if you are asked about the mechanism of action of this drug, inhibition lang ha sa enzyme called HMG-CoA reductase, which is an enzyme involved in the cholesterol biosynthesis pathway. Now, what will be the effect of taking statins? Now, since this one is inhibiting the enzyme that will lead to the production of cholesterol, syempre the effect will be reduction of the cholesterol synthesis and upregulate LDL receptors on hepatocytes to reduce the production of LDL sa liver mismo. So both na dietary origin na cholesterol or liver, di ba ang liver nato nagaproduce ng cholesterol, kana class na effect tanan si statins din ha. Dietary origin man or liver produced. But in terms sa triglycerides, maka-affect siya pero ano lang, dili kaayo jud siya maka-reduce og triglycerides. Okay? Questions so far about our statins? Wala? Have your cell phones there? Kindly research what rhabdomyolysis is. Moinom lang kog tubig, I'll be back. Okay, so kung tutunlan. Pagbalik na ako, paninglanta mo sa rhabdomyolysis. Again, rhabdo, R-H-A-B-D-O, and then myolysis, M-Y-O-L-Y-S-I-S. Okay, let us continue. So, naan na mo'y gisend. Life-threatening syndrome resulting from the breakdown of skeletal muscle. Okay, sige. Okay, let's continue. We'll be talking about rhabdomyolysis later. Clinical applications of our statins. They are the first line drug for atherosclerotic vascular disease. So if we have lipid profiling of our patient and at risk siya of having atherosclerosis or there is atherosclerosis na, the first line drug are the statins. So para siya sa mga acute coronary syndromes na form na ang plaque and na-obstruct na ang arteries, especially in the heart. Now, I'm going to give a research na rhabdomyolysis because this is a board exam question. The number one side effect or toxicity ng ating statins is rhabdomyolysis. So, dili pwede class na pataka lang kag-inom ani nga drug because remember, kamo mismo nag-research, gisend ninyo sa chat, ang pinakaunang pirmi na ko mabasa, it's life-threatening. Why it is life-threatening? The statins can actually cause muscle death So the muscles will break down, and the contents of these muscle fibers will go to the bloodstream. And our problem, these are big molecules. So if the blood will go to the kidneys, magka-problema ta sa kidneys ani. Okay? So it can actually lead to kidney failure. So that's the problem with our statins. Mag-cause again o rhabdomyolysis. So this is the reason why I told you a while ago that most of the doctors now are prescribing rosuvastatin because among them, lesser ang iyahang rhabdomyolysis na effect. Pero ang kanang mga simvastatin, actually grabe ang rhabdomyolysis ana. There will be myopathy, there will be muscle pain, there will be muscle cramps, and pag dili maagapan, example, ma-overdose na yun ang patient, that's the time mamatay ang mga muscles, and mag-leak ang mga content, maadto sa kidneys, mag-cause og sakit sa kidneys. By the way, ang rhabdomyolysis is not just caused by statins, ha. There are other drugs that can also cause rhabdomyolysis. Actually, when we do overexertion, grabe nga exercise, grabe nga exercise, it can actually also lead to rhabdomyolysis, meaning there will be muscle death also, and parehas lang ang effect. So, dili pud ta mag-overexert sa atuang mga sarili. Pag dili na kaya, ayaw po, grabe na. Napiliton yun ang sarili. Okay? By the way, alcohol can also cause rhabdomyolysis. So be careful po sa inyong pag-inom og alcohol, ha. Dili anong class. Magsigig, palaigit, palainom. Kasi again, it can also cause death of the muscles, and that kung magsigi-sige na lang siya, actually kung namatay ang muscle, it's okay, pero pag magsigi-sige na gani siya, and maapektuhan na ang kidneys, mauwi na gid na siya sa kidney failure. Okay? Water na lang para safe. And then aside from that, statins can also cause hepatic dysfunction because remember, the cholesterol synthesis takes place in the kidney, in the liver, and dito man siya mag-take og effect. So kadugayan, there will be dysfunction of the liver itself. So these are the important things that you need to know about our statins. Yesterday, I think I have mentioned that except for rosuvastatin and atorvastatin, the rest, lovastatin, fluvastatin, pravastatin, and simvastatin should be given at night. Kasi naman, ang cholesterol synthesis takes place sa gabi. So kay short-acting drugs man sila, so gabi nato siya ihatag. Kung sa buntag nato sila ihatag, wala may cholesterol synthesis, so may useless ang atuang drug. But the atorvastatin and the rosuvastatin are long-acting statins, so you can just give them even in the morning. Kaya pa nila mag-take og action pagsugod sa cholesterol synthesis. Okay? Questions? Anything na you want to ask or clarify? Wala, magtubig na lang daw si Rosel. Pero mo inom og alcohol, wala man jud class kanang nindot na effect ang alcohol sa lawas. Diba? Sa sinugdan sa ato ang pag-study of pharmacology, kanus ba ko nag-mention og nindot nga effect ni alcohol in the body. So ano ba yata? Benefit over mga harmful effects or mga risk. So far sa sinugdan, daghan na kayo ato ang na-discuss na effect ni alcohol. Okay? So ayaw na lang, tubig-tubig na lang ta. Okay, next we have the fibrates. This one is another group of drugs nga ginagamit for problems with cholesterol and triglycerides. We have fibrates, examples, we have fenofibrate, and ang nasa open and closed parentheses are the example ng mga brands in the market. And then we have the gemfibrocil. Brand name is the lipid. I think the Lipway is also phenofibrate. Natay sa ka-brand sa phenofibrate sa market. Lipway ang pangalan. Lipway SR. LIPWAY and then SR, sustained release na drug. Now, how about the mechanism of action of our phenofibrates? They are actually agonists of the PPAR alpha. When you say PPAR alpha, it means peroxisome proliferator activated receptor. So this type of receptor actually regulates the lipid metabolism, and it will increase the activity of lipoprotein lipase to metabolize our foods na ginakaon na fatty foods, and ang iyahang effect ana kapag activated na siya nga receptor is more ang excretion ana na mga chemical substances, mga fats and mga oils, and that will lead to the decrease in the triglycerides in the body. So aside from the triglycerides, since appeal ang trabaho ni lipoprotein lipase, there will be decreased secretion of the VLDL. Pag babay mo ang VLDL, baba po na imuhang triglycerides class. And then since PPAR is involved in the activity of the enzyme, so there will be increased activity of the lipoprotein lipase. And aside from that, na siya effect on the levels of the HDL. So it has a beneficial effect of increasing the level of HDL in the body. So where do we use our phenofibrates? Syempre, since it can decrease the triglycerides, so this is more of the hypertriglyceridemia. And para sa mga persons na babaang HDL. So again, we don't give phenofibrate to hypercholesterolemia ha, kasi it has really nothing to do with cholesterol. It's more on the triglycerides. So ang toxicities naman of our phenofibrates, the one in bold class, una siya ang pinaka common. So we have their mild gastrointestinal disturbances. We still have here the myopathy. Myopathy is anything involving the muscles like muscle cramps. Apil na dira sa myopathy ha. And then hepatic dysfunction, and our problem, the PPAR alpha agonist, is the formation of the gallstones. Okay, questions about our phenofibrates? We only have two. Not the phenofibrates, the fibrates. One type of fibrate is the phenofibrate. Pero kung may maisip ba mo ganang pinaka-common, kung mag-work mo sa hospital or sa community pharmacy, mas common you'd see phenofibrate compared to gemfibrozil. Wala pangutana. So the third group of drugs used for lipid disorder is the bile acid sequestrants. Again, bile acid sequestrants. We have three here: cholestyramine, cholestyramine, and cholesevalam. Again, cholestyramine, and cholesevalam are all bile acid sequestrants. Now, what is their mechanism of action? Their mechanism of action is actually the sequestrant man sila, or si tawag ana ha, chelating, mura gud sila og chelating agent class. Diba naghantag chelating agent sa laboratory, mura sila magnet. They will bind, sequester, or chelate the bile acid for secretion. Pag ilahan ning example na inom kag cholestyramine, si cholestyramine class, kuaunin niya ang bile acid, idikit niya sa iyang sarili, and then after that, i-excrete. So, via the feces ha. So, paano siya nakatabang karon sa tao nga taas ang cholesterol? Remember, the bile acid is produced from cholesterol. So, if you get rid of this, now ang atuang body is in constant production of the bile acid. So gikuha nato ni gi-excrete. Our body will now get the cholesterol from the other parts like sa blood or somewhere else, basta kuwaon niya ang cholesterol to make more of the bile acid. So nigamay ang cholesterol karon sa ato ang blood, for example. Nya padayon kag inom aning mga bile acid sequestrant, so padayon pud ka og pag excrete aning bile acid. And ayun, this will again result in the increase sa catabolism, pag-breakdown sa cholesterol. So muna siya, that's how the bile acid sequestrants help in the decrease in the cholesterol in the body. So aside sa pwede po siya mag-upregulate sa LDL receptor. So ang effect yun class sa ato mga bile acid sequestrant is more on the decrease of cholesterol, especially LDL. Kasi si LDL mo na siya ang ginahimo nato og bile. So kaya ato amang thermic inconstant gina-excrete ang bile, so magsigipod na og kuha ang ato ang lawas og LDL, from example from the blood, para maghimo og more bile. I hope nasabtan na siya ang bile acid sequestrant. Now for the clinical application, syempre pangitaon nato itong mga lipoprotein disorder that involves elevation of the LDL. So katong type 2A and type 2B, mao to sila ang mga types of disorders nga na ay increase in the LDL. So mao to ang clinical application sa bile acid sequestrants. And aside from that, digitalis toxicity. Kasi aside from the bile acid sequestrants can actually sequester also the digitalis or the digoxin. So na-mention na nato na itong niagi, diba? Na arrhythmia is the life-threatening toxicity of our digoxin, and that we use either lidocaine and phenytoin if na ay arrhythmia. Pero kung gusto nato igawas gyud nato class ang digitalis, either we can use the bile acid sequestrants, igawas jud ha i-excrete just like sa ginahimo niya sa bile acid, or actually ang board exam question ani, I think I failed to mention the digibind. The digibind or the digifab, o ni siya ang ginagamit na murag antidote para sa digitalis, para magawas nato siya. Hindi siya mag-cause of toxicity, especially during overdose. So aside from that, the cholestyramine itself is used for pruritus, for kaning mga katul-katul nato sa lawas. Again, kasi sequestrant man sila, so it can sequester, aside from the bile, it can sequester drugs, and it can also sequester toxins. And cholesevalam can be used for type 2 diabetes mellitus. Okay? Mga ano lang na sila, mga additional use nila. Now, toxicities, kung nakita ninyo, we have here the bold one, constipation. So, ano mag-constipation? Ano mang good, ang excretion of the bile is through the feces. And then, aside from constipation, you have there the bloating, and it can actually interfere with the absorption of some drugs and vitamins, because remember, sequestering agent sila or chelating agent sila. So, pwede nila ma-sequester apil ang mga vitamins or other drugs nga ito ang ginainom. And this one is the board exam question, the steatorrhea. This is really common to our bile acid sequestrants, ang steatorrhea. Ano meaning sa steatorrhea? Fats or oil in the stool. Pag malibang ang patient class nga nagainom og bile acid sequestrant, makita gid nimo na naay anang ma-incorporate na oils or fats sa iyahang stool. We call that clinically as steatorrhea. So, common na siya kay may trabaho ni bile acid sequestrant. Ang bile acid made up man of cholesterol. Okay? Questions so far? So far about this. By the way, si steatorrhea kay common food siya syempre sa brand name, generic name sa lesofat ug sa senical, Orlistat. The Orlistat. Mana ilahang ginaingon na messy pag moinom ka og Orlistat kasi igawas man jud nimo ang fats and oils through the feces. So may steatorrhea po din hang part. Now, the bile acid sequestrants are actually contraindicated sa people with hypertriglyceridemia. Contraindicated na siya kasi this is more on the cholesterol. So, ayaw siya ihatag sa na ay taas na fats and oils in the body. Na-confuse mo ha? Ay, wait lang. Okay, and then, ikapila na ni siya. Ikalima, we have the sterol absorption inhibitor. We only have one drug here, the ezetimibe, brand name is Zetia. Ang mechanism of action anemia is, this one is a different one ha, receptor. Inhibitor siya sa receptor called sterol transporter NPC1L1 receptor ha na makita sa atuang intestines. Now, unsa ang trabaho ana nga receptor? Actually, that receptor is responsible for the absorption of cholesterol from our diet. Sa atuang mga ginakaon nga cholesterol, di ba? Atuan na siyang i-metabolize and that syempre from the intestine ibalhin na siya sa bloodstream. And ang responsible ana is that receptor, NPC1L1. So if mugamit ta og ezetimibe class, we are actually inhibiting the absorption of cholesterol from the intestine to the blood. Para dili mo taas ang blood cholesterol level nato. So aside from dietary cholesterol, it can actually inhibit also biliary cholesterol. Cholesterol na produce pod sa atuang bile or sa atuang liver. Okay? Now, what are the effects of taking ezetimibe? Syempre, it inhibits the absorption of cholesterol from the bile or ang cholesterol nga gikan sa atong pagkaon. Thus, it can decrease the LDL in our body and it can even decrease the phytosterol. By the way, the phytosterol, di ba, the cholesterol we get from our plants. So actually, it can also lead to phytosterolemia, daghan ka og phytosterol sa body. So ang clinical application ni ezetimibe katong conditions nga taas ang LDL sa ato ang patient or kanang naay phytosterolemia, overeat ni siya ani og vegetables rich in phytosterol. Pasubrahan, dili ta magpasubra basig ang imong gikaon dira kay dili na balance. Kailangan magud balance na siya. Diba mo ganitong elementary ta go, grow and glow, i-balance nato na siya kasi we need everything. Dili pwede nga isa lang imuhang pirmi kaunon. Example, carrots na lang imong ginakaon adlaw-adlaw. Magkarotinemia pud ka ana pud ang sa phytosterolemia. The toxicities of our ezetimibe, we have here low incidence of hepatic dysfunction, though magka-problem sa liver, pero so far, dili man nga to kataas ang nagkaroon ng problem. So low incidence lang, and myositis, inflammation of the muscles. Most of our drugs for lipid disorders are actually affecting the muscles. And lastly, I think this one is the last one, the niacin. So, di ba tarana? Tarana is thiamine, riboflavin, and niacin. Niacin is actually vitamin B3. Our other name for this is nicotinic acid. So, vitamin B3 is actually a drug for our lipid disorders, and ang mechanism of action ni vitamin B3 is inhibition of lipolysis sa adipose tissues. Therefore, ma-reduce pod ang pag-produce of free fatty acids that is magamit nato in the production of triglycerides. So again, vitamin B3 can decrease triglycerides in the blood, and it can also reduce the formation of VLDL from the liver. Because remember, VLDL is used to make triglycerides also. So therefore, kung tanawan nato ang effect ni niacin ng vitamin B3 sa lawas, syempre mag-decrease si lipoprotein A, si LDL, and ang importante din ha, si triglyceride, mag-decrease pod. Pero na-effect si niacin sa liver na maka-trigger siya sa pag-release ng daghang HDL. So where do we use our vitamin B3? For familial hyperlipidemias and severe hypercholesterolemias. So both triglycerides and cholesterol ang kaya ipababa ni vitamin B3. But vitamin B3 can cause gastric irritation. It can cause flushing. This is a board exam question. Pag ginabold yan ako na it's a board exam question, maka-dilate mo siya blood vessels and mamulag ug kahit feeling nimo init imong lawas. But the treatment for this is aspirin. Now, we have low incidence, just like ezetimibe, there is low incidence of hepatic toxicity. It may also reduce glucose tolerance, but it can increase the uric acid in the body. So katutanan mo ni ato ang mga drugs for lipids. Last na class ang nicotinic acid or ang vitamin B3. Questions so far? We are done with chapter 27. So appeal na siya sa inyuhang exam. Again, appeal na siya sa inyuhang exam. Kanitanan ha. So sa iya to ang coverage sa to ang midterm exam. Let me check. You have there the chapter 21. What is chapter 21 again? We have the vasodilators and treatment of angina pectoris. Gamay lang di ay. Tulo lang ka chapters class laban, Japan. Chapter 22 are the histamine, serotonin, and the ergot alkaloids. And lastly, the drugs for hyperlipidemia. So I suggest you do a lot of readings because since we have limited time, so my discussion is also limited. If you have books of pharmacology there, please read those 3 chapters. You still have time kay, diba, daghan man og holiday. So pagbasa mo, additional readings because I think may mga masali sa exam na ako na I was not able to really say it during the discussion pero ma-appeal gid siya mo nang kailangan ninyo magbasa ug daghan. Sa 3 chapters para pero